This is all the Portuguese you will get. I know some more, but I think I will use English all the time. So this is going to be, I think the first lecture was perfect to set the scene. Now this one will be a little bit lighter, okay? So that you also enjoy. You will need to do a lot of exercise with the colors. So we are at the beginning of our research, right? All research should start with an idea that becomes a question, research question. Then we will build on that research question into a protocol. And once that's finished, then we will start collecting the data, recruiting the patients, then collecting the data, and so forth, right? And only at the end, we will, take our results to the Congress. Most of the time, actually, I have my colleagues coming to me saying, I have a Congress in 2 weeks, the deadline. I need to write an abstract. Let's do something, okay? That is not research. That is just going to the Congress. Trying to go to the Congress. Okay, so I totally agree with Richard. I hate this dichotomy of qualitative and quantitative research, but I need to put it out because of the type of questions we ask in the different researchers. So qualitative research is more about open questions that you cannot answer with numbers. So how does this happen? So who is doing this? What is happening? So to understand phenomenon, right? But then if you want to confirm what you got in qualitative research, you will need quantitative research at the end, okay? So you want to study your health organization, then you do qualitative research, and then you want to introduce a change, then you will have to confirm whether that change is really efficient and it's efficacious or not to improve your organization, right? Then you will go to quantitative research, and then that's why you're here today. So quantitative research only answers 2 types of questions. Is it? How much? So it's occurrence and association. Just these 2 basic questions, okay? And different types of research that will go to that. So in quantitative research, we cannot ask open questions, okay? Those will belong to either a line of research, so you go one question after the other, or that is qualitative research, right? So we need to pose questions that can be answered by yes, no, or by a number. So yes, no, does this or that produce that? Or does this mechanism explain that? Or is there an association between this and that? Is yes, no? We will see. And in terms of numerical data, what is the survival based on whatever? How much does this improve the quality of life? How strong is the association? So it will be a measure of something. So now that we know that we have to make questions that give us yes, no, or numbers, we have to make them good. So what makes them good? Otherwise, you will waste resources. Richard already mentioned it. A lot of our research is based on bad questions, okay? And to know if it's good, we will use the FINER approach, okay? I will go in a minute. And then another acronym that we will need will be the PICO. I brought my automatic PICO generator there in case you don't have questions that are original enough, okay? So first, understand what makes a question good, and then how to formulate it well. And to formulate it well, we will need to know also the type of question. So what makes a question good? First of all, it has to be, well, if I ask you, how are you? You say, I'm fine, right? So fine will be much better than fine, right? So this is how we want our questions, much better than fine, okay? So the F stands for feasible. When we start doing research or asking questions, sometimes we don't know exactly whether it will be feasible or not. In my institute, I work with Esti and Maria Jesus. Whenever somebody comes to us with a project, Esti says, yes, let's go for it. It's feasible. Everything is feasible for her. Maria Jesus is always, oh, no, that's impossible. We cannot do that. That is not feasible. I'm always in between, right? Usually Maria Jesus is more in in the safe side, and she's right most of the time. So we embark ourselves in very difficult questions. But it's because we care much about the I, the interesting. Interesting has to be for you, not for your boss. It has to be for you, the ones who are doing the research. Why? Because if it's not interesting for you, you will say, okay, let's do this lousy. Yeah, we can skip that part. But if it's interesting for you, you will try to, go to the nest and, skip vacations and not have that baby because there's no time because your research is more important. No, you don't do that. But it has to be interesting, right? Then novel. I mean, this is not completely necessary. The problem is if it's not novel, you will probably not go to the Congress because everybody already said that. It's a little bit of waste, right? So it's repeating the same question one and another. Yeah. Sometimes it can become novel if you just use a different technique or you just use a different outcome or a different population in which maybe things are different. So you need to have a hypothesis that, yeah, this is really novel. It's different, right? Then ethical, I'm not going to explain that. If it's not ethical, you should not be doing, like the experiment Richard wanted to do, like smoking. No, we cannot do that, right? And then the one that gives quality to the film is relevant. What makes a question relevant? So a question is relevant if the topic has a lot of importance because it's a deadly disease. There is a lot of variability. There is a lot of uncertainty, or either because it produces a lot of impact on people. So that makes the research important and relevant. And also, it makes the research relevant if with your question, you can actually improve that. So you need to answer a question or to pose a question that by answering it, you can actually modify something that is going very bad. So remember in the pitch that you will have to do later on, you have to set the scene, the problem, and the problem needs to be relevant, and your question needs to be a question that actually addresses the problem and does something to the problem, okay? But sometimes the question doesn't need to be completely an interventional question. It can be just by knowing what the problem is, sometimes that makes it change. The awareness of a problem also makes it change. So just think about these terms. Whenever you set the question, think whether it's feasible. Maybe you don't know, but the others you can truly know. Okay. Next, to formulate the question, you need to identify what type of question it is. Right now, we are always thinking about efficacy because we are in this traction, pharmacological intervention, non-pharmacological interventions workshop, but maybe we are not only formulating those type of questions. And the design of the protocol is going to change completely. So we have descriptive questions. Sometimes we can describe what the system looks like, and maybe we can see two different systems and describe them, okay? Frequency and descriptive is the same. Etiology, what causes, a system to collapse, right? Prognostic and efficacy sometimes are very close because the factor can be actually an intervention or something that, you are measuring, you are just observing, but there is an intervention in there, okay? And then also diagnostic efficacy or safety, which are the most generalized, and then also validity. You need to know what type of question you are asking, otherwise you will be lost. And finally, the construction of the research question. I have my time in Spain, but yeah. So a reference in the population, which is in whom I want to know something, and the other is what I need to know, okay? So in whom is the population to which you want to generalize at the end, and the what is at the end will be the main variable or the main outcome of your study, So if you only have these two, you already have a research question. So how do we formulate it? Basically, we use the PICO, right? And the PICO is easy to see in Spanish. I don't know how you say outcome in Portuguese. You say outcome in English? Resultado, yes. So it would be PIC, yeah? So that's why we say it always in English, even in Portuguese and in Spanish we say PICO. Okay, so actually population intervention comparator outcome only works for efficacy and safety questions, right? When we move to etiology, prognosis, and diagnosis, or to descriptive questions, we only have PO or PO, okay? So if we want, let's do a random question. So in order to do a research question, the first thing you need to do is to identify what your population would be. So do you want to just raise first one? It's in Spanish, but I would not say. Whatever. No, I'm sorry. Oh, this one? Okay. General population. And then you, the outcome? Oh, whatever. Oh, diagnostic. You open the first one. This is not random. Yeah, I want it random. Yeah, open a random. Oh, general population. And then open a random all. Yes. Okay. Cerebral stroke. Okay? So we could have a descriptive study on what is the incidence of a stroke in the general population. But maybe we can look at an etiological factor now. Let's go to the eye. Physical exercise. Okay. So the intervention would be physical exercise. It could be a factor. We could study a prognostic study, but we could also make it into an interventional study, right? And maybe you can find a comparator for us. Placebo. Okay. So how can we make that happen? But this is an original question. That's something, yeah? Maybe we have to think about the final later on. But let's see other questions, right? So now I want to ask you, we are going to have some questions, and I want you to have the colors in there, because I want to ask you, in this question, what is the prevalence of autism in Paris? Very quick, which is the population? 1, 2, 3, up!
Raise high.
High.
You never know who is correct. So
Okay, don't worry. The population is Paris. It's the green. The green. Now, what is the outcome? What do you want to know in Paris? Yes, autism, right? So this is the easiest one. The population is Paris, and the outcome is autism. If you don't have this right from the beginning, you are going to make it very complicated for the design.
If you have a doubt, you can.
Yeah. You can tell me.
We will go into the next step, so better to have this clear.
Yes. Next question. Next question.
No, it's there.
Yeah, but something came in front. So yeah.
It's working?
Yes. It was, I don't know what that pop up. So now, different question. What is the incidence of nephritis in lupus? Which is the population, the P? I see greens, it's lupus, right? Okay, it's like, I feel like house, it's lupus. Now, what is the outcome? Well, it can be nephritis or lupus nephritis. That's fine. If I see red, it's fine. It's, I will measure only nephritis because I already have people with lupus. So I don't need to look for lupus nephritis. Nephritis is fine. Now, what is the mean vitamin D levels in the Swedish population? Which is the population? This time you got it right. Yeah, Sweden, 10 points. Yes, all right. And then what is the outcome? The mean levels, okay, the mean vitamin D levels. Yes, okay. Very good. I like the combination of colors. It looks like Barça. Okay, now for etiology. Does low self-esteem cause bradypsychia? Nobody knows, understand the question, okay? Don't worry. Just what is the population in there? Is it difficult, huh? So I only see 2 greens. Actually, where do you want to know this question? You only wanted to know in people with low self-esteem? You wanted to know in general, right? So this is a general question. Sometimes when you are asking something in the general population, you just don't put it in the question. You don't ask, does self-esteem cause bradypsychia in the general population? You just ask it like that, right? So it's the people in general or general population? And what is the outcome? Yes, the yellow. Bradypsychia, whatever that is. I think it's slow, like in the morning, yes? Right? And what is the intervention or factor? Because this is an etiological question. The I becomes F. Self-esteem, whether it's low or high, because self-esteem you can measure with a yes, no, low, yes, no, or you can measure with a scale, right? So the variable, the factor is self-esteem. Now, it's getting more complicated. Do patients with psoriasis and arthritis have poorer prognosis than those without arthritis? Oof. What is the population? Wow, nobody got it? Oh, yes, the woman in red got it. It's psoriasis. It's everybody has psoriasis, and then some of them have arthritis and others don't have arthritis. Yes, because the factor is what you just. The factor is arthritis. Yes, no. This is a difficult one because people put it like that, like I put it on top. Do patients with psoriasis and arthritis have poorer prognosis than those? They don't put it exactly like my factor is arthritis and my population is psoriasis and my outcome is, what's my outcome? Prognosis, okay? It doesn't matter whether it's poor prognosis or prognosis in general, whatever we use. So if we had said only for the population, only people with psoriasis and arthritis, we will not see the factor because everybody has the factor positive, okay? And if in the factor it were psoriasis, everybody had psoriasis. So this is very important because I got it wrong many times in the projects that I get. Sometimes they start the introduction and the question is very clear, and then they move to the population and they got it completely wrong. They only select the ones who have the factor, and then we are out of the question. So this is very important that you keep the question, the PICO, always very clean, very, very clean. Okay? Then, to make it even more complicated, well, efficacy is easy. Is aromatherapy efficacious compared to inhalers in reducing the number of relapses in asthma? What is the population? Asthma, you all got it right. Perfect. What is the outcome? Red, yeah, relapses, you got it right. What is the intervention? Aromatherapy, yes, or color therapy, I see here. Aromatherapy, and the comparator, inhalers. Yes, the only one that is left. Yeah. So in efficacy, it's clear. But now, this is the most difficult one. Okay. Safety, because this is exactly the question that they ask me. Does using antiepileptic drugs cause serious cognitive impairment compared to not using them? What is that I highlighted? Is this the population, the intervention, the comparator, or the outcome? What is serious cognitive impairment? The outcome. Yeah, I highlighted in yellow to drive your answer. Yeah. Now, what is antiepileptic drugs? Yeah, I see many colors. Yeah, the intervention, the green. Yeah. And not using them? Comparator, that's easy. But which is the population? Well, do general population take antiepileptics? Yeah, people that need antiepileptic drugs. And then you have to do a lot of research to understand, well, you can take them for epilepsy, but also for chronic pain, and also for what other conditions, right? Neurological conditions, whatever. Okay? So this is what I wanted to bring here. I hope you enjoyed. Think about the finer all the time. That's it. Okay? And if you need questions, the questions I can make them here.